Today we will be discussing gastroenteritis, also known as gastro. Gastro is caused by various pathogens or causative agents which infect the intestinal tract. Viruses cause up to 70% of gastro cases, with rotavirus being the most common pathogen. Various viral bacteria are also common causes of the infection. 10 to 20% of gastro cases are caused by bacteria. Some of the most common bacteria which cause gastro include Salmonella. The most common way an infection is through person-to-person contact or through fecal contamination of food or water. Symptoms generally occur within the first 24 hours of ingesting the gastrobacteria, and it may be associated with many symptoms such as dehydration, diarrhea, nausea, vomiting, abdominal pain, bloating, fever, weakness, muscle aches, and bloating. Children as young as 8 weeks old have the potential to contract gastro, and in severe cases, children are expected to be hospitalized due to a combination of dehydration and elevated temperatures. Regardless of different levels of severity, gastro typically resolves on its own in 2 to 3 days after illness contraction.
The outcomes of gastro depend on the severity of the infection and how it is treated. In patients with acute gastro, the best possible outcome of leaving the infection untreated is that the immune system treats the infection on its own, thus allowing the body to maintain homeostasis. In fact, many people who suffer from acute gastro do not seek advice from a health professional. As gastroenteritis is caused by bacteria, the body's innate immune response would be able to fight off the infection within days of first symptoms, hence allowing the patient to feel relief after symptoms after 2 to 10 days. This would be the best possible scenario should a patient leave gastro untreated.
The most severe cases of gastro can be fatal if left untreated, especially when rotavirus, norovirus, or foodborne bacteria such as Salmonella or E. coli are present in the body. Cases of deaths from gastro have decreased in the past 30 years. However, there is still an estimated 2 million deaths annually in developing countries from this infection, as well as it being one of the most common causes of death in children under the age of 5. Severe dehydration from loss of water in the stool or vomit is one of the main reasons gastro can be fatal. A general practitioner is often the first health professional seen by a patient suffering from mild cases of gastro, as they can provide medical advice for self-care or prescriptions for required medications such as antibiotics after the patient has given a stool sample. However, if symptoms are more severe, hospitalization may be necessary, meaning the best health professionals for treatment and care for severe gastro are nurses and a specialist, specifically a gastroenterologist.
The treatment of gastroenteritis mainly depends on the severity of the symptoms. Rehydration is the primary therapy in managing any type of diarrhea and the least expensive treatment. Breastfeeding is also one of the best ways to reduce gastroenteritis. The main aim of gastroenteritis management includes rapidly determining and managing the fluid loss, dehydration, and electrolyte abnormalities, which leads to serious morbidity and mortality. Dehydration due to diarrhea can be independent of age, causative agent, or initial sodium values. The management of diarrhea of any cause includes continued feeding. Antimicrobial must be used for those with bloody diarrhea, severe chlorea, or serious non-intestinal infections. It's also important to educate parents and caregivers about necessary hygiene and feeding practice that would reduce dehydration. If symptoms are prolonged, then medical attention may be required, as well as possible diagnostic testing if symptoms do not ease. A more expensive treatment option occurs to patients with gastroenteritis who do have symptoms such as a high fever or extremely prolonged and bloody diarrhea. Prompt medical attention is then required. Antibiotics such as macrolide or quinolone can help shorten the duration of the illness. Macrolide antibiotics over many years have played a significant role in the chemotherapy of infectious diseases. Depending on the type of gastroenteritis, such as traveller's diarrhea or salmonella, as well as its severity, It then determines what course of antibiotics may be needed.